Hello, and welcome to the video on COVID-19. My name is Dr. Suniel Bapat. I'm a public health and preventive medicine resident physician at the University of Saskatchewan, and I'm working with the Canadian Centre for Health and Safety and Agriculture for this video. COVID-19 is a newly identified infectious disease caused by the virus SARS-CoV-2 and is a part of the larger family of viruses called coronavirus. The diseases in the coronavirus family range from mild illnesses, such as the common cold, to severe illnesses, such as Middle East Respiratory Syndrome, MERS, and severe acute respiratory syndrome, SARS. While coronaviruses can affect both animals and humans, human coronaviruses specifically are known to cause respiratory infections. This particular coronavirus was thought to arise from animal origins out of a wet market in Wuhan, China in late 2019. In early January of this year, the WHO responded to a cluster of pneumonia cases in Wuhan, China of unknown causes. On January 11, the novel coronavirus was identified and genetic sequence was shared. On January 13th, the first case of novel coronavirus was identified outside of China in Thailand. On January 25th, the first presumptive case in Canada was a male traveler who arrived in Toronto from Wuhan, and the case was confirmed on January 28th. On January 30th, the outbreak was declared a public health emergency of international concern by WHO. On February 11th, the WHO announced a name to the novel coronavirus, COVID-19. On March 11, the WHO assessed COVID-19 as a pandemic, and the first case was identified in Saskatchewan on the same day. Here is a global map of COVID-19 cases provided by Johns Hopkins University as of May 21st, 2020. As you can see, there are over 5.1 million confirmed cases of COVID-19 worldwide and over 332,000 deaths. During the declaration of the pandemic on March 11th, the director of the WHO, Dr. Tedros Ghebreyesus, mentioned that we cannot say this loudly enough, or clearly enough, or often enough. All countries can still change the course of this pandemic. Like every province and community in Canada, we are adjusting to the realities of the COVID-19 pandemic and have had to make major changes to our lives to help keep us all safe during this difficult time. At the present time, COVID-19 is causing mild to moderately severe symptoms and some deaths. The virus spreads through close person-to-person contact. COVID-19 symptoms may range from little to no symptoms to severe illness and death. Most symptoms are usually mild and begin gradually 2 to 14 days after exposure to the virus. The most common symptoms include dry cough, fever, and fatigue. Other symptoms include aches and pains, diarrhea, nasal congestion, pneumonia, runny nose, sore throat. And urgent symptoms include difficulty breathing or shortness of breath, new confusion or inability to wake or decreased alertness, persistent pain or pressure in the chest, loss of consciousness, So this list of urgent symptoms is not all-inclusive. Please consult with your healthcare provider for any other symptoms that are severe or concerning. There is a self-assessment tool you may complete online for further instructions on the Government of Saskatchewan's website, and I've left the link here for you. So why are we concerned about this virus? While the range of symptoms appear to be similar to the common influenza, the fraction of people with severe disease is different. With COVID-19, 15% are severe and 5% are critical, which is notably higher than influenza. For COVID-19, current understanding is that older age groups and individuals with underlying conditions are at an increased risk for severe infection. The increased risk in some of these groups seems to be notably higher than influenza, but data on this will continue to evolve. Mortality for COVID-19 appears higher than influenza. The data so far suggests a crude mortality rate between 2 to 4%, but these estimates may vary from jurisdiction. And while seasonal influenza is well below 0.1%. However, there are many factors when considering this, and the COVID-19 data will continue to evolve. While there are many trials that are underway, currently there are no vaccines or effective therapies for COVID-19, unlike influenza. So who is at risk? People with medical conditions, including heart disease, hypertension, lung disease, diabetes, cancer, people with weakened immune systems from a medical condition or treatment, such as chemotherapy, and older adults. The disease can spread from person to person through droplets from the nose or the mouth when the infected person coughs, sneezes, or exhales. And it can spread through surfaces by touching surfaces with the virus on it and then touching your mouth, nose, or eyes before washing your hands. For diagnosis of COVID-19, the coronavirus infections are diagnosed by a healthcare provider based on symptoms and are confirmed through a laboratory test. The test is usually done by taking a nasopharyngeal swab or a throat swab. This is the area at the back of the throat between the nose and the mouth and is reached through the nose with a long swab like a long Q-tip. As with most respiratory illnesses, most people with COVID-19 illness will recover on their own. At the moment, there's no specific treatment for disease caused by SARS-CoV-2. Severe or worsening symptoms may require supportive treatment in hospital. If symptoms feel worse than a standard cold, call Healthline at 811 in Saskatchewan or your local Healthline or COVID information line. And unless it's an emergency, do not go to see a healthcare provider without calling ahead. And if it's an emergency, please dial 911. And if Healthline recommends you to seek acute care, they will provide you with instructions to call ahead. So it's important to note that most people recover from this disease without needing special treatment or intervention. Prevention. Currently, there is no approved vaccine that protects against COVID-19. Vaccines and potential drug treatments for COVID-19 are being developed and tested worldwide. Normally, vaccines can take 10 years to develop or longer. For COVID-19, vaccine development has been dramatically accelerated. An accelerated vaccine development program might take 12 to 24 months. The best way to protect yourself against COVID-19 is through everyday preventive actions, including washing your hands, often with soap and water, and if soap and water are not available, use an alcohol-based hand sanitizer. Practice proper cough and sneezing etiquette into the bend of your elbow. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect your home regularly. Maintain safe food practices. Avoid close contact with people who are sick. Avoid unnecessarily travel to affected areas. Social distancing. This means avoiding large crowds and maintaining a physical distance of 2 meters from other people, so not shaking their hands, hugging, or kissing. Wearing a non medical mask, even if you don't have symptoms or asymptomatic, is an additional measure you may take to protect others around you. Health Canada has issued a recommendation to wear a homemade, non medical mask or facial covering in the community for periods of time when it is not possible to consistently maintain a 2-meter physical distance from others, particularly in crowded public settings such as stores, shopping areas, and public transportation. Public health officials will make recommendations based on a number of factors, including the rates of infection and/or transmission in the community, and these recommendations may vary from location to location. Wearing a mask alone will not prevent the spread of COVID-19. You must consistently and strictly adhere to good hygiene and public health measures, including frequent hand washing and physical social distancing. So here is an illustration of how to put your mask on and washing. So it's important to wash your hands before and after mask use. Avoiding touching the mask, changing your mask when it's wet or dirty. It's important not to share your mask with others. Additionally, homemade masks can be contaminated on the outside, and it's important to use laundry services if they are soiled or dirty. Here's a handout from the Health Canada that you may have received in the mail, and it is regarding washing your hands. So as this diagram explains, and the first step is to wash your hands with and wet your hands with warm water. Then apply soap. Then scrub for at least 20 seconds the palms and backs of each hand, in between your fingers, under your nails, and in between your thumbs. Then rinse well under water. Dry your hands with a paper towel, and then turn off the tap using a paper towel. Here's another insert that you might have received in the mail from Health Canada as well, and general steps to avoid reducing the spread of the coronavirus disease. So this includes following the advice of your local public health authority, washing your hands often with soap and water for at least 20 seconds, using an alcohol-based hand sanitizer if soap and water are not available, trying not to touch your eyes, nose, or mouth, avoiding contact with people who are sick, coughing and sneezing into your sleeve and not your hands, and staying home as much as possible. And if you need to leave the house, practice physical distancing of 2 meters. Protecting yourself and preventing the spread of the disease. So try to pay attention to the surfaces you touch with your hands, particularly in public settings. When in contact with frequently touched surfaces such as door handles, payment pin pads, remember to wash your hands often. And try not to touch your eyes, nose, or mouth with unwashed hands. COVID-19 has impacted many of our livelihoods in local communities across Saskatchewan, nationally and around the world. Through preventative measures we have taken, we have managed to minimize transmission and strengthen the capacity of our healthcare system. Another important aspect of this approach was to develop a plan that would eventually allow Saskatchewan residents and our provincial economy to emerge from isolation. The Reopen Saskatchewan plan is built on methodical and phased-in approach to slowly and responsibly lift restrictions on businesses and services. Restrictions will be lifted in 5 phases with consideration given to socioeconomic factors and the risk of transmission. Here is a list of resources of COVID-19 from the Saskatchewan Ministry of Agriculture. We have the general information page. We have the farm stress line, which offers support during COVID, the effects of COVID on animals, physical distancing in agriculture, Saskatchewan Agriculture Regional Offices support, and the Reopen Saskatchewan plan. Additional COVID-19 resources, please visit the Agricultural Health and Safety Network for links to resources and information at www.aghealth.usask.ca. Please visit the Canadian Agricultural Safety Association for more information as well at www.casa-acsa.ca. Thank you for watching this video. On behalf of the Agricultural Health and Safety Network, my name is Dr. Bapat.